Watch closely as this fighter's eye appears to pop out when he blows his nose. Welcome back everyone, I'm Dr. Nav, and today we're going to be discussing orbital fractures, more specifically severe post-traumatic orbital emphysema, which is what we're seeing here in this video. Orbital emphysema is what we saw with Warlley Alves during UFC 283, but also with other fighters like Mark Martin, Donald Cerrone, and I'd be remiss not to mention the orbital fracture that Joel Embiid suffered during Game 6 against Toronto back in 2022, and Michael Bisbing, who suffer from some of the worst outcomes from orbital injuries such as detached retina and glaucoma that eventually required a prosthetic eye. You might actually recall when he takes out his eye on camera. Before we get started, consider smashing that subscribe button, especially if you love sports and if you're interested in learning more about the medical side of sports injuries. And make sure you hit that thumbs up button if you learned something new today. Let's take a look at these injuries. When there's a concerning blow to the eye, the first thing a doctor will do is push their thumb to the lower portion of the orbit, because that's where some of the most common fractures occur. You push in the area and assess for any clear palpable deformity that suggests an underlying fracture. And they'll ask the fighter if he can still see through the eye, check to see if the extraocular movements are intact, and as shown here, they'll shine a light into the eyes to see if the pupils can contract in response to the light. This quick exam tests to see if cranial nerves 2, 3, 4, and 6 are still working. When an athlete has pronounced orbital emphysema, it can actually feel like Rice Krispie treats when you push down on it. In order to understand why this happens, we have to understand the anatomy. We want to start with the bones first. Here we have the frontal bone, the sphenoid bone, the ethmoid bone, the nasal bone, the maxillary bones, and the zygomatic bones, which are the most common area where fractures can occur in mixed martial artists. Next, let's orient ourselves with the sinuses. Here is the frontal sinus, maxillary sinus, sphenoid sinus, and the ethmoid sinus, also known as the ethmoid air cells. Knowing these landmarks, imagine a fighter taking a fist, an elbow, or a leg to the face, leading to an orbital fracture that breaks the barrier between the sinuses and the orbit. Air enters the orbit through the fracture or a tearing in the lining of the sinuses, and activities like blowing the nose, sneezing, or lifting weights can increase intraorbital pressure, trapping air due to fibrous tissue. This trapped air causes pressure, leading to characteristics like swelling and bulging of the eye in orbital emphysema. Aside from seeing soft tissue injuries and scar tissue that could potentially limit the movement of the eye in the future, in severe cases, this can actually lead to complications like vision loss. You could see that from a compression of the optic nerve, leading to ischemic optic neuropathy, or retrobulbar hematoma, which is a collection of blood behind the eye that causes proptosis. You can also see compartment syndrome, which is when the accumulation of air or fluid creates pressure within the orbit that causes tissue damage and nerve damage and muscle dysfunction. This can be irreversible if not treated promptly. Or retinal artery occlusion, or retinal detachment, or glaucoma. You can also see infections that might develop over time, and even something as rare as an air embolism, which is when air trapped in tissue around the eye enters the bloodstream and causes a condition where air bubbles block blood vessels. This can cause tissue damage and organ dysfunction and can even be life-threatening. Treatment for orbital emphysema typically involves addressing the underlying cause of the condition, such as repairing a fracture or tear, and managing symptoms with measures such as pain medication and applying ice to the affected area. Fortunately, in most cases like this, the air is reabsorbed by the body. It just takes time, and as long as there's not any underlying fracture, you typically don't need surgery for something like this. If you're experiencing this right now while you're watching this video, I highly recommend you go to your primary doctor's office or an urgent care or the ER. Sometimes this can be very, very serious. This is also why doctors recommend combat athletes not try and blow their nose in the middle of a fight, especially if they've taken on a lot of damage to the face. I hope you guys learned something new today. If you did, make sure you hit that thumbs up button. Comment below, let me know some questions you might have, or if you want me to cover any injuries that you've seen recently. Alright guys, peace.